Hello, my name is Josh, and this is my assistant, Natalie. I'm a registered nurse who works in a critical care setting, and I rely heavily on blood pressure monitoring. And I'm here today to discuss and demonstrate the proper technique of taking a manual blood pressure. Now, in today's healthcare system, many providers have become reliant on automated blood pressure devices, and though these are both safe and effective, I believe that the skill of taking a manual blood pressure should not be lost as a result. Um, so I would like to begin with just discussing what blood pressure means. When you go to your doctor's office and they take a blood pressure, they give you a set of numbers. Maybe you're 118 over 98. So this means that you have a systolic blood pressure of 118, and systolic blood pressure corresponds with the heart during its contraction when it's actively pumping blood into your system, and obviously a higher number than the diastolic, which is when the heart becomes relaxed and is refilling. So a more in-depth discussion would be needed to talk about how these numbers relate to one another, but for today we'll just settle with knowing the systolic and the diastolic and what they mean as far as corresponding to the heart. The equipment we use is a sphygmomanometer or a blood pressure cuff and a stethoscope. Thank you, Madeline. And now I'm going to give a step-by-step demonstration of how to take a manual blood pressure. Now, when you have your patient sit down, you want them to sit down, you want them to try to be as relaxed as possible. You don't want any legs crossed or any constrictive clothing above where you're going to be taking the blood pressure, because that will ultimately affect the reading. So, with Madeline here, in any young patients, you like to describe it as the blood pressure cuff's going to be squeezing or hugging, but it's not going to cause them any pain. And when you apply the blood pressure cuff, you want to make sure you have the proper size. This is an adolescent cuff, and it rests just about an inch below the armpit here, and about an inch above where your elbow would crease. And with the stethoscope, I'm going to be listening at the brachial artery here, just like this. And now, when I inflate the blood pressure cuff, I'm listening. When I inflate the blood pressure cuff, I'm going to be occluding the arteries, and then when I release it, I'm going to be listening for the first sound, which is going to correspond with the systolic, and the last sound, which will correspond with the diastolic. So as you're inflating, you allow your patient to rest comfortably. You say, okay, we're going to begin the squeeze here. We're going to pump it up. And about 120 is a safe starting point for most children. That's where I'm going to begin. Now release the blood pressure cuff here, and I'm going to listen for my first sound. At about 98 will be my systolic. And 64 will be my diastolic. So Miss Madeline has a blood pressure of 98 over 64. And above here, I've written some normal parameters for an age group. Madeline is 7 years old. And her systolic blood pressure is 98, which falls between the 90 and 110, and systolic of 64, which also falls between the normal parameters of 50 and 70. So what the results mean, if you fall within normal limits, that's obviously where we want you to be as healthcare providers. But if you're outside of these parameters, typically on the higher end is when we want to start treating the high blood pressure. High blood pressure can be indicative of many chronic diseases such as congestive heart failure, heart attacks, stroke, kidney disease, just to name a few. So if you do find that you have high blood pressure, please go and talk with your doctor about how we can treat that. So in conclusion, I'd just like to do a quick review of what we learned today. We know that measuring blood pressure is a critical assessment tool. We've explained the equipment used, the sphygmomanometer, blood pressure cuff, and our stethoscope. I have shown proper technique, and we've gone over what the numbers mean. Now, just to emphasize, 1 in 3 Americans today have high blood pressure, and of those, about half of those go untreated. So, I want you to know that this is a modifiable disease, a preventable disease, so if you do have high blood pressure, please go and get it treated. Thank you.